This is your COVID-19 weekly briefing for May 15th. We're tracking the declining cases in the Pocono Mountains and working to help reopen the region responsibly. Look at what it could take to create a vaccine for the coronavirus.
And what testing is available now and over the coming months. Plus, we discuss unemployment assistance with those helping people in the Poconos.
Good morning, everyone. Thank you for joining us live online and on air for this COVID-19 weekly briefing. I'm Chris Barrett for the COVID-19 briefing team. We are now in our 6th week. We hope you'll find our information useful and share it via your social media feeds if you are watching online or on YouTube. First, we want to thank Blue Ridge Cable TV13 and East Stroudsburg University for partnering with the Pocono Mountains Visitors Bureau to bring you this program. Remember, you can get up-to-date information at our website, poconomountains.com/COVID-19. Over the last few weeks, we've been watching the numbers closely. So let's consider where we are today. When we first undertook this program, our objective was to keep our friends and neighbors informed. The number of new positive cases and deaths each week were escalating initially. We knew, and more importantly, you knew, we had hard work to do to overcome the virus. In our 6th week, we are happy to report that your attentiveness to social distancing and heeding the advice of our health systems is working. So what do we mean? What you're seeing in front of you right now are some of the numbers. The first sets of numbers are for the Pocono Mountains. As you can see very clearly, it looks that our numbers are great. I mean, going in the right direction, but of course, we still have some more work to do. However, we're getting closer to the mark. Next slide, please. This is the one we really wanted to show you. This predictive model shows that the Pocono Mountains, being the 4 counties of Carbon, Monroe, Wayne, and Pike, could be at the 50 new case level on a 14-day average by the week of 5/19. And you could see the Northeast PA region, which is the larger region that the Pocono Mountains is in, would be much later at 6/1. Cases and deaths in PA as of May 14th. This is a sobering statistic, but one we do have to cover, unfortunately. Cases at 59,636. Deaths, unfortunately, 4,218. And negative cases at 251,559. Again, this information is at poconomountains.com/COVID-19. As in previous briefings, joining us are the presidents of St. Luke's Hospital Monroe Campus, Don Seipel, and Lehigh Valley Hospital, Pocono, Elizabeth Wise. Elizabeth, always great to see you.
Yeah, thank you, Chris. I know I typically end my segments with the story of hope, but today I am headlining with hope, as this week we celebrated the 1,000th hospitalized LVHN COVID-19 patient being successfully discharged. 2 of the patients featured in this video montage, Steve Abdo and Bill Cohen, were proud Lehigh Valley Hospital Pocono patients. These patients and to the incredible, selfless, fearless Lehigh Valley Health Network staff who helped make their recovery a reality. And as Chris noted earlier in the program, we are definitely seeing a downward trend with the number of new COVID-19 cases in Monroe County and also the number of hospitalized patients at Lehigh Valley Hospital Pocono. So congratulations to Chris and the Pocono Mountains Visitor Bureau and to the entire Pocono community for successfully helping to flatten the curve. I would also like to thank the Pocono community, as the data from this past week demonstrates that you have taken what Donna and I have said to heart and have not delayed needed medical care. In fact, this past week, our Lehigh Valley Physician Group Pocono physician office visits and the number of scheduled elective procedures were at 90% of pre-COVID patient numbers. Additionally, last week, 70% of our physician appointments were done through face-to-face encounters, and 30% were done through video visits. So those numbers have flipped from the previous weeks, where 70% were virtual visits and 30% were in-person encounters. And if this isn't reason enough to celebrate, this week is also National Hospital Week, where we acknowledge every hospital, health system, and person involved in keeping our communities healthy. At Lehigh Valley Hospital Pocono, our physicians arranged for a thoughtful display of banners and a complimentary lunch, acknowledging all staff contributions in providing superior health care. I've worked at many other organizations, and this is a level of generosity that I have not seen from our physician colleagues recognizing our staff. And so these types of gestures that bring me much pride in leading the mighty Pocono Lehigh Valley Hospital team. Next up, Dr. Tim Friel, Chair, Department of Medicine, Infectious Diseases for Lehigh Valley Health Network, will provide an overview of the highly coveted race taking place across the world to develop a safe, effective COVID-19 vaccine.
The race is on to develop a COVID-19 vaccine.
We have some brilliant minds looking at this problem and tackling this on an international basis.
Currently, more than 70 different agents are potential candidates. Some have even started early clinical trials.
It's on small scale, but it's really the first of many potential steps that are going to be necessary to truly vet and prove that a vaccine can and will be effective.
Dr. Timothy Friel is an infectious disease specialist with Lehigh Valley Health Network. He says it typically takes 15 to 25 years to develop a successful vaccine. There are many painstaking steps and careful procedures that take time and cannot be skipped.
It is not as simple as turning on or off a light switch.
Once a safe and effective vaccine is ready, the next hurdles are mass production and global distribution.
Over 7 billion doses of this vaccine potentially, theoretically, could be necessary.
Dr. Friel says coronavirus is not new to the world.
There's about 4 typical coronaviruses that circulate seasonally and cause things like upper respiratory tract infections, sinus infection, and the common cold. So a lot of experience with those.
Prior to the unprecedented COVID-19, 2 novel coronaviruses have wreaked havoc internationally, MERS and SARS-1.
So I think it was during that epidemic that we recognized and gained great respect for the potential devastation that this new type of virus could cause.
But in 2003, doctors were puzzled when the SARS-1 outbreak just faded away after a few months.
Not totally sure why that behaved in such a fashion, but I think everyone was thankful that SARS-1 disappeared.
So, could the same happen with COVID-19?
I think the answer that I have is unlikely, but ultimately at the end of the day, we just don't know.
When it comes to developing a COVID-19 vaccine, anticipation is high, but Dr. Friel says practicality is key.
So this is tricky. This is unlike anything we've ever had to experience or go through before as a society.
For Pocono Television Network, I'm Brianna Strunk.
Thank you, Elizabeth. It's always great to see you, Dawn. It's always great to turn to you, too. Every time I see you, too, the news gets better and better every week, and you have great stuff to talk about. So, Dawn, we're going to turn to St. Luke's now.
Thank you, Chris. Good morning to the Poconos. You know, another week of quarantine and COVID-19 is now under our belts. There has been a lot of talk this week about beginning to return to normal. I understand the angst and frustration. At the same time, we continue to see signs of positivity and hope. As Chris just reviewed the new case statistics from Monroe County and the Poconos, cases continue to decline at a nice rate. As we know, this is one indicator that is used in determining the movement from red to yellow which is an important step in returning to our new normal. Likewise, we continue to see less patients needing inpatient care. COVID-19 patients represent a small number of the patients we are currently caring for and of the patients we are testing. Only a small number are testing positive. In fact, we have some days with no patients testing positive. There has been much debate and discussion about how we will begin to return to the new normal, moving from red to yellow. I do know that we need to continue to mask, practice good hand hygiene, and continue to social distance. These measures that have become part of our new normal will help to ensure the success of our business, the return to normalcy in our personal lives, and that we keep the COVID-19 virus at bay, ensuring we stay healthy. Practicing these simple measures is a sign of respect to all of those around us. We are seeing patients beginning to return for care other than COVID-19, and I want to reassure you, we have measures in place to ensure our patients, visitors, and employees are safe. As I said last week, it is time for you to make your health a priority again. This week, we thought it was important to focus our healthcare segments on vaccines, as we've just seen, and testing, as many questions have come up regarding these two areas. As you will see in the following segment, we will discuss how COVID testing has been used and how it will be helpful in managing the virus moving forward. I wish you and your family a safe and enjoyable weekend. Be safe.
When the virus began to spread in Pennsylvania, public health officials turned to testing to help track it and administer care to those in greatest need. St. Luke's University Health Network went into action, providing mobile testing sites where someone with symptoms could get a test. Dr. Jeffrey Jerry is an infectious disease specialist treating COVID-19.
And what one does then is to get a specimen that is either done with a swab through the nose or through the back of the throat. And that test now can be run both in-house at St. Luke's, and we also have arrangements to run it with many commercial laboratories like LabCorp.
Dr. Jerry explains this type of test can get accurate results back within 24 hours, helping doctors begin to isolate others who could have been infected.
Those tests that we do right now for active disease, an individual can get that by going through any St. Luke's urgent care or any St. Luke's practitioner's office, and that test will be processed.
For some time, a shortage of testing material set limitations on the amount of testing that could be done.
There you go, perfect.
Now, Dr. Jerry says there's a new test approved that is a lot like a rapid strep test, which will go a long way to help with mass testing.
So we do advise, if you're going to be going to a physician's office or to an urgent care, that you do call ahead. Currently, the advice is to try and limit the testing to people who have symptoms or who have some other reasons, such as very close contact with an active case.
Now that the surge of cases has subsided, Dr. Jerry believes contact tracing can be an effective way to start limiting the spread of the virus.
Contact tracing relies on the ability to not only identify a positive case, but then to take a look at individuals who've had close contact with that positive case and see if they're positive.
That's because about 1/3 of people who have COVID-19 will have little to no symptoms, meaning even if you feel relatively fine, you could still spread the virus. If doctors and nurses at St. Luke's can identify someone with the virus through testing, the patient can quarantine for little more than a week, and that's a big way to help prevent it from spreading. One more kind of test is available, an antibody test, which determines if you had COVID-19 already by testing for the antibodies that fight the infection. If you are in need of a test, call ahead to 1-866-ST. Luke's. Jim Hamill for the Pocono Television Network.
I want to again thank Dawn, and I also want to thank Elizabeth as we, are heeding their advice as we move forward here. As we go from yellow to green, of course, their advice will be critical as we navigate that. And again, thank you. We'll be joined by some panelists with information on state unemployment, which is another issue we'll have to discuss. But first, we'd like to share an update on a new program introduced by the Pocono Mountains Visitors Bureau, the Pocono Promise. The Pocono Promise is our pledge as a region and each individual business to abide by public health guidelines established by the CDC as well as the PA Department of Health. Owners, thank you, or managers of any business throughout our region can go to PoconoMountains.com/Pocono Promise and adopt these guidelines and protocols. The guidelines and the promise apply to everything from restaurants and hotels to professional offices and barbershops. The Pocono Promise is designed to help the public and each business's employees to know the right steps are being taken to keep them safe and healthy. We have had dozens sign the Pocono Promise already and hope hundreds, if not thousands more, will do so as we get ready to reopen the Poconos for business again very safely. We will have more on the Pocono Promise coming out Monday with a virtual signing ceremony and some additional information, and we hope that you can join us. Right now, we're welcoming Mackenzie Strunk and Christine Bush. Both represent state lawmakers in our area. Mackenzie for Representative Rosemary Brown and Christine for Senator Mario Scavello. Thanks for joining us.
Thank you,
I
Chris.
know you both have been extremely busy answering phones around the clock and trying to help people facing unemployment. So for me, and for the first time, I think a lot of people need to know who's answering those phones and helping everyone. Not only are you helping with the unemployment issues, but you're helping with all types of issues with hundreds and hundreds and probably even thousands of calls in the last 2 months. But one of the statistics to me that was incredibly sobering as we started to prepare for this segment is that Pennsylvania now has the highest unemployment claim rate in the country. And this is information that we did get from these folks. As of 5/11, Labor and Industry is reporting 1,824,000 new claims. And that's since March 15th. 211,000 are the PUA claims since 4/18, which we'll ask these folks what that is. And by way of comparison, this is an interesting statistic. Pennsylvania had roughly 775,000 initial claims filed in all of 2019. So these are incredibly sobering statistics as we move forward. So we wanted to ask a couple of questions to our panelists so they can give some information to all of you watching today. So I wanted to ask you, Mackenzie, first. What's the overall outlook for the unemployment compensation system now?
Well, I think the previous slide gave some good information. I mean, there is 1.8 million claims that have been submitted to the unemployment in Pennsylvania, which, like we said, is the highest in Pennsylvania. Obviously, that puts a dramatic stress on the system and really tested it. I know the Department of Labor and Industry did bring over some additional staff members. They hired staff, and they brought some over from other departments. I know the Department of Revenue sent some staff members over. They also brought on actually retired staff members to help with those additional claims. So I think we're hopefully in a little bit of better shape than when we initially started.
Making a little bit of headway, hopefully.
Hopefully.
Okay, good. Christy, we're not going to leave Christine. We wanted to ask some specific questions. We asked a couple of folks what they would like you guys to talk about. And one of the questions that came up is, suppose there's a problem with somebody's claim. What's the best thing to do, Christine?
So a lot of the times, thank you for having us, by the way. Good
morning.
morning.
Gosh, great to have you back.
We're very happy to be here to hopefully try and give some people information that might be helpful to them as they navigate through the system. There are lots of different issues that could cause your claim to stop. Some people have been seeing that inactive message where they actually have to speak with a human being to turn them back on. Like Mackenzie stated, Pennsylvania, it's not the best thing that we can be saying right now, but Pennsylvania is the highest in the country for unemployment rate. And that 775,000 claims that they received in all of 2019, since March 15th of this year, we'd received almost triple that amount in a short period of time.
So the 775,000 was 12 months.
12 months.
Wow.
So since March 15th, we had received 1.8 million claims, which, like I said, is the highest in the country. Our system is outdated for labor and industry for unemployment claims. Therefore, when somebody has an issue, let's say you fill out part of the questionnaire that says, it says, are you able to work? Are you unable to work? And somebody says, well, yeah, I'm unable to work because my business is closed. That is not the correct answer. If you put that you're unable to work, it basically states that you maybe have a physical disability where you cannot be working right now, not that your business is closed. We have to understand that the system, again, is old and it's not COVID-19 up to date. Everything has kind of changed at this point. So when you put that you're unavailable to work, it kind of puts you in a black hole. And unfortunately, you need a human being to actually go in, search your social security number, and pull up your case. That when you have 1.8 million claims, you don't get looked at. In the past, they would see a red flag. Somebody in labor and industry would say, oh, what's going on with this? Call the person and say, you have an inactive, or you filled out, is this correct? And they would say, no, I'm able to work, and it would get situated. That's not the case. We're having a lot of those issues, whether someone there's a question in there that states how much did you make or how much would you have made the week prior? And sometimes people are getting that confused and putting the amount of money that they would have made in the section where how much money did you make? And that throws you into a dark hole. There's a couple variables that's happening, and again, it requires somebody. So you have to get one of our offices on the phone. We are putting people on a list, and we're calling first come, first serve to our one contact in the state. Unfortunately, we have legislative departments for all of our agencies. This is what our office does. A lot of people don't know what our office does unless you've utilized us before. We work with any type of state agency or department issue. So our job is to mediate between, our offices and state officials. Right now,
that's what I'm not terrible. That's one thing I wanted to ask. There's been a lot of people, right, that have never dealt with the system before.
Correct.
So I noticed that there were some terms like PUA. What does that mean, Mackenzie? Is that what is that?
So when you apply for unemployment, you'll either qualify under regular unemployment compensation or PUA, or sometimes people call it PUA. But it is
baseball
But that was made eligible through federal legislation through the CARES Act. There was money that was allocated to the state governments that would then allow people who have never been able to qualify for unemployment compensation before, self-employed, gig workers, independent contractors, can then apply under the under this PUA system. So that is an entirely new system. The whole system the infrastructure had to be created, not only in Pennsylvania, but across the entire country. So that was initially accepting applications as of April 29th. And it was only at that point accepting applications. It was officially rolled out May 7th. And I've heard of course there's issues with it, anything with a new system, but I have also heard some success stories that people are starting to get unemployment compensation through this PUA.
Well, that's good news. Zach, could you put the last tips back up? Because these two lovely folks were talking about the last slide that you had up. Because it did, thank you. So some facts, and this is some information that both Mackenzie and Christine gave me beforehand. So if you worked in a different state, you need to file for unemployment compensation in that state. I know there have been some people that have had that issue. If you do not work, you're not eligible. If you did not receive a W-2, you are not eligible. And we just went over PUA, so thank you for that, Mackenzie. And I know you had talked about this being a very outdated system, so that's kind of causing many, many problems as we go forward.
And if you don't mind, I'll just say in regards to this slide, they're taking your base year, unemployment is taking your base year from October of 2018 to September of 2019. So if in that period of time, I know I had said if you did not work, you are ineligible. You would be eligible for PUA. That's for people that are ineligible or maybe have exhausted their state benefit they could possibly get that under the Federal CARES Act. But they're looking at that base year. So some people started working in Pennsylvania in 2020, January 2020, they moved here and they say, well, I live in Pennsylvania, I'm going to apply in Pennsylvania. But it's for your base year. So we just want to remind people, wherever you worked, usually 2018, 2019 is where you're going to look to apply for those wages.
That's a good tip. And speaking of that, we have one last slide with tips, Zach, if you can put that up for us. These folks gave us some great tips too that we want to impart as we start to close the segment, but have your personal paperwork ready. File online. There's the website link there. The URL there that you can file with. Don't call, just file. use the UC guide to determine eligibility. Don't call. That is also at that website. Read everything extremely carefully. We want to really emphasize that. Submit or inquire once. Very important information. And one thing I wanted to make sure that I covered is please be patient and respectful with legislative staff. These folks, the two folks that are sitting here right now, there are a lot of folks really working in their offices and in a lot of our elected representatives' offices that are an incredible resource. And they're getting to the calls as quickly as they can. And really, they're doing the best job under incredibly arduous circumstances. So I want to thank you two for being here so much and giving us some time this morning, because I know you guys are busy. You're watching the COVID-19 Weekly Briefing here on the campus of East Stroudsburg University, brought to you by the Pocono Television Network and Blue Ridge Cable TV13. We want to thank Kim Bell, the General Manager of TV13, and Zach Booth. An additional thanks to Kurt Burton from ESU. You can also watch this live, streaming on YouTube, and afterward on PoconoMountains.com/COVID-19. We'll be back next week with new guests and critical updates for you. Before we go, we want to take a moment for a sincere and well-deserved congratulations to the young men and women who are graduating this year. 2020 has so far led to a non-traditional way of learning and now receiving diplomas. So for every student from our high school senior classes and to these ESU graduates, we wish everyone the very best as they move into the future with the degree they worked so hard to earn. As always, make sure you thank a frontline hero for watching over us as we flatten the curve. I'm Chris Barrett. Thanks for watching. Do your part by being informed. Visit PoconoMountains.com/COVID-19.